To truly connect the full spectrum of talent available in today's dynamic world, it is imperative that we actively reach out to diverse communities. Such outreach not only broadens the recruitment pool, but it also signals the county's commitment to inclusivity and diversity. By intentionally connecting with various communities such as schools, colleges, veterans and military personnel, and diverse networks, we can uncover hidden gem individuals who bring unique experiences, perspectives, and skills that might otherwise remain untapped.
In today's interconnected world, bringing diverse perspectives to the hiring table isn't just a noble gesture, but a strategic necessity. By ensuring that raters and screeners represent a mix of backgrounds, perspectives, and viewpoints, we're able to identify talent that truly elevates our organization, challenges inherent biases, and paves the way for a richer and more inclusive workplace culture. Please remember that a mosaic is most beautiful when each piece is distinct and contributes to the bigger picture.
A lot of we've been able to do as a collective in this clinic is work on food insecurity. Many of us suspected that a lot of the chronic disease that we were trying to manage with our patients, some of the root of it was nutrition. And we asked folks, well, what are you eating? And why do you make those choices? Like, what's available to you? And so I think for about 6 years now, we've been screening patients for food insecurity. We started with a smaller group, diabetic patients and patients who were pre-diabetic. And we've now expanded to screening folks at almost every visit. I would say about 10% of our patients are screening positive for food insecurity. One of the really important things we're able to do is collaborate with our social work team and community partners, such as Second Harvest of Silicon Valley. And for patients that are vulnerable, once they're identified with food insecurity, we're able to give resources, but also have a social worker come in and piggyback on our visit and enroll them in food resources. And in some cases, we're able to get food to folks delivered within 48 to 72 hours. And in a more sustained way. And we also actually provide food boxes every Monday at the clinic, and we try to curate the food boxes in partnership with the San Mateo County Health Foundation to make them healthful, to make them foods that our patients like to eat.
We've also done newcomer clinics here at Fair Oaks. So that's patients and families that are new to the county or new to the country, and more often they're new to the country. So they need vaccinations to get their kids into school. They need all these kind of other sort of well-child checkups. So we have created half days at both the Sequoia Teen Clinic as well as pediatrics to do these newcomer clinics that we can get sort of net new families into services and connected into the healthcare system.
In response to our discovering known health disparities, we've taken the patient navigator approach to supporting and serving identified patient populations. Right now, our external kind of facing metric is around our Black or African American patient populations. Right now, our metrics are focused on hypertension and depression screening and follow-up, but the ideal state of things is that we learn more about that particular patient population and how to then provide better care for them. And Ideal State is also working in collaboration and developing interventions that work alongside our Black patient populations, and also trusted partners who might be further along in this journey than we are.
So the equity training I found very valuable because it taught us about our shared history in this country and the effects that it still has on our daily lives and our relationships with one another. What I appreciated most from it was that it provided a safe space to have some very sensitive and honest conversations with my coworkers, conversations that I might not feel comfortable with having with some of my best friends. It was a really nice opportunity to be able to do that with some of my coworkers. And I believe that it will really made us closer and helped increase communication, and so these conversations helped build understanding and trust with my coworkers.
Every month, we learn about cultures, holidays, and segments of society. It brings us out of our cubicles to talk and work with people we would never probably talk to other than a passing greeting. Yet we're only a couple of yards away, like this guy right here.
Yeah, this actually allows us to all learn more about each other. We hope that this brings everyone closer as they have a sense of belonging. We're introduced to their lives, struggles, and their hopes and dreams. Well, the partnership between the wellness and the team is important because it's just like what Kim On Lee had said. There is no diversity, equity, inclusion, and innovation without a good mental and physical health. They both go hand in hand. You can't have one without the other, as we are all in this together.